Finding the right doctor is a critical part of ensuring a safe cosmetic procedure. We have two doctors here with us who have a few more tips you absolutely need to know. Dr. Anthony Youn, who we met earlier, is a board-certified plastic surgeon, and Dr. Ellen Marmur, a board-certified dermatologist. Thank you both for being here. And Dr. Youn, let's start with you. You have two very important tips on how to pick a plastic surgeon. What are they?
So the first one, you want to make sure your surgeon, if you're having surgery, is certified by the American Board of Plastic Surgery or the American Board of Facial Plastic Surgery is okay if you're thinking about it for the face. And the big thing is you want to avoid doctors who are masquerading as plastic surgeons. I mean, throughout the country, there are ER doctors who are performing facelifts. There are ophthalmologists putting in breast implants. There are ENT, ear, nose, throat doctors doing tummy tucks. And I call it the Wild West of medicine. That's what plastic surgery is nowadays.
Why is that allowed? That makes me crazy. You have dentists who are giving Botox. I mean, it is insane. You wouldn't perform a hysterectomy, would you?
The crazy thing is state regulations. They will regulate what doctors can practice, that they are actually a doctor, but they don't restrict doctors from practicing outside of their field of medicine. So just like you said, I'm a board-certified plastic surgeon, but I could legally perform a knee replacement or a hysterectomy as long as a patient signs on the dotted line. There's no law against it. I mean, it's crazy.
So make sure you're sticking with someone who specializes in plastic surgery, and you can actually evaluate them by checking out their ratings online.
Yeah, so the other place you can go to, there are online rating websites. There's ratemds.com, there's makemeheal.com, realself.com. You know, we look at customer reviews for products that we buy online. Why wouldn't we do this when we're looking for a plastic surgeon? So patients will list their testimonials and how they felt about the surgeon. You always have to look at it with a little bit of grain of salt, though. There are reports of these sites being spammed, doctors putting their own reviews of themselves, or angry patients.
Wikipedia.
Exactly, angry patients putting in 12 reviews, all with different names on the same doctor, the same experience.
Right, but it can be a useful tool. Dr. Marmur, does the same go for picking a dermatologist?
Yeah, I mean, dermatologists often, the fields are kind of blending a bit now, where there's less invasive plastic surgery, so it's more non-invasive, and dermatologists have led the way with liposuction and fillers and toxin injectables and all sorts of things. So there's a lot of overlap in some of the cosmetic fields now, but I think the key point is that there's something called a core of cosmetic surgeons, and so that's facial plastic surgeons, dermatologists, and even some ENTs. When you're having an OBGYN, and I love my OBGYN colleagues, doing Botox or fillers of the face, they're not really as comfortable with the anatomy of the face as those in the core.
Or as experienced, by the way.
Or as experienced.
How do you prevent yourself from becoming a guinea pig, as Michelle was, for a product that's being used off-label, if you will?
Yeah, I simply would just say, have you ever done this before? Or how many cases have you done? Or if the doctor is like literally shaking as they're approaching your face, that's a big red flag.
Yeah, obviously.
But the truth is, you know when that doctor is serious and when that doctor is comfortable evaluating your face, looking at your beauty, not making you a mimic of some other cardboard copy of what is considered beautiful.
You also say to avoid these coupons. You get assaulted online with these great deals, right, for people who are going to give you a bargain on injections and things like that.
Right. So you might get your like 9 a.m. coupon on the email saying like, come in and get your Botox for $100 at some random spa. But that's really not where you want to save your money. And as people have said, if you want to save your money on a pair of shoes, go for it. But not something that's actually cosmetic surgery. I tell my patients it is cosmetic surgery. It might look simple, but there's so much knowledge and experience that goes into every injection we make. And you really want to invest in yourself and take your time and wait till you can afford the right thing.
What if a doctor is trained outside the country? I mean, a lot of doctors in the United States are trained elsewhere. Should that raise a red flag for people?
It should, because you want to, in the United States, really, plastic surgeons, I'll tell you, we're the most expensive in the world, but we're also the best, and our facilities are the best. And there are even stories of people going overseas on plastic surgery safaris. You go to a third world country, you save money, you have an adventure. Well, this is not necessarily the adventure you want to have. If you develop a complication and you're in Africa or South America or Mexico, do you want to be sitting in one of their hospitals? And your health insurance is probably not going to cover it, your United States health insurance. So this could be devastating both to your health as well as to your pocketbook. The best thing is stick with the core specialties, board certified certified doctors here in the United States, and at least you know you're going to get that modicum of safety.
And do your research and ask questions.
And always have follow-up. I mean, every time you're with a real doctor, you need to see them back. They're going to get you through all of this. And so if you're going to a spa one time, you're never going to have proper follow-up. God forbid you do have a complication. We also know how to handle the complications.
Well, Dr. Ellen Marmur and Dr. Anthony Youn, thank you so much for coming by and giving us such important information that will hopefully prevent tragedies like we saw here today. Thank you so much for watching today. I'll see you next time.